or enamel is being lost and lost, then you will drag to the problem that is the sensitivity, hot and cold sensation, thanda or garam lagna. That is the permanent problem. And the whitening of the teeth is a temporary cosmetic issue, so please don't drag yourself only for the cosmetic purpose to the permanent problem. बेहतर ये है कि आप अपने टीथ को ख़राब होने ही ना दें, आप अपनी ओरल हाइजीन इतनी मेंटेन करें कि आपके टूथ ख़राब ना हो. Very good, beta. Well done.
Thank you very much, sir. And you have highlighted the applied side of this paper. And the next speaker, Mr. Manoj Kumar. And other contributors are Parveen Akhtar and Dr. Khalida Nas. So Manoj Kumar is requested to come forward and present his topic, which is determinants of adolescents' depression among patients attending outpatient department of a tertiary care hospital. So huge round of applause for Manoj Kumar. Manoj, you have 5 minutes to conclude, so please be quick. We are extremely sorry to all the presenters that we are giving you short time, but it's format and we have to complete within the time. Introduce briefly and then just go for your methodology, results, and recommendations. Thank you.
Respected guests and dear student, Assalamu alaikum. Today my topic, determinants of adolescent depression among patients attending outpatient department of tertiary care hospital. My name is Manoj Kumar. Completed my BS nursing from LUMHS and completed my masters in public health from LUMHS Jamshoro. The outline of my presentation is that adolescent depression, according to WHO, adolescent depression is a unipolar depressive disorder among the adolescents, and this is caused real of life disability in the worldwide. And there is a neglected public health issue which is mostly concentrated and focus on this issue. The rationale of this study, there is a limited number of studies conducted in Pakistan. So we have to conduct this study and recommended that mostly awareness sessions on this issue to come less down to the adolescent depression. The objectives of my studies is to determine the proportion of patients diagnosed with adolescent depression among total reported patients, identify risk factors, depression among the adolescents, and find out the behavioral and symptomatical changes in adolescents toward the depression. My hypothesis in my study, females are more prone to have depression than gender biases. Setting outpatient department of tertiary care hospital, Liaquat University Hospital, Hyderabad, and Sir Kaus Ji Jahangir Institute of Psychiatry, Hyderabad. My study design, comparative cross-sectional study. Study population, the age group I set in my study 12 to 18 years of age, adolescent age, and sample technique, not probability, complexity sampling. Sample size 225 in this my study. Data collection method, simple structured questionnaire will be designed in my study and collected from 225 adolescents participants who attend the outpatient department of tertiary care hospital, Liaquat University Hospital, Hyderabad, and Sir Kaus Ji Jahangir Institute of Psychiatry. And data were analyzed in SPSS version 16. The results of my study, the proportion of male and female as compared to in other studies, that the females are more prone to have depression. But in my study, the males are more prone to have depression than females. Proportion of male and female depression adolescent disorder, there are 52% male have a depression in my studies according to data collection, and 48% females have adolescent depressions. The other factors which contribute in the adolescent depressions are the unemployment, that will be the great impact in adolescent depression. All of the independent variables were found in significant in this study, but family history, which we consider more prone to that in other diseases, that family history contribute more in other diseases, that family history is positive. But in this study, family history is not insignificant in this study. The symptomatical changes, which is low mood, sadness, and lost weight, these are the symptomatical changes in this study, and some behavioral changes were identified also, that some adolescents have aggressive behavior in this study. The conclusion of this study, there's a significant proportion of adolescent male and females are found in suffering from adolescent depression, but male have more prone to depression than females. My recommendations are we increase the awareness session in the communities that slow down the depression among patients, and we guide mental health practitioners regarding the mental health issues, and recommendation to make such feeling available to academic sites, and means के हमें जो मतलब academic sites है वहाँ पे ये चीज़ें हमें मतलब as scenario पे हमें publish करवानी चाहिए, ताकि easily वो चीज़ें identify हो सकें और जल्द से जल्द हम उसको treat कर सकें और decrease कर सकें.
Thank you very much. And a huge round of applause for Mr. Manoj Kumar for covering it within the estimated time. And if there is any question, you can write it down, and Manoj is here to respond later on. Thank you, Manoj. The next speaker is Ms. Tasleem Bibi. So Tasleem Bibi is requested to come forward and present her paper. And the topic is factors hindering to research utilization in nursing practice at a public tertiary care hospital. Tasleem Bibi. After that, Ms. Iram will come, so please be ready, Ms. Iram. After Tasleem, you are going to present.
The respected panelists, all guest speakers, respected faculty members, and dear participants, Assalamu alaikum. I am Tasleem Bibi, working as a clinical instructor at Liaquat College of Nursing, Female, Jamshoro. As since yesterday, we are talking about the research and its importance. So no doubt my topic is related to somehow that the factors hindering to research utilization in nursing practice at public tertiary care hospital. As we all know, nurses are providing the best care to the patients, but what they have learned in their curriculum, nurses must use the evidences. What are the new evidences that could implement in their research? So we should find out these. These are my outlines. I would start introduction that globally, research has become the vital part of every profession. So in nursing, we also need the research to provide, and by using these researches, not only the conduction of the research is important, we have to use these findings in our practices to provide the safest, efficient, and very effective care to the patient, not only in the clinical side, but also in teaching and management to improve our findings, to improve the outcome. And definitely it's a very essential part, but it's the most neglected part of the healthcare system. We need to identify what can be the factors and what can be the causes that are basically obstructing the nurses, that are hindering the nurses, why they are not using new evidences in their practices. The studies, we have many nursing researchers, but most of studies found majority of the nurses don't take interest in the research. And on one study indicated only 60% of the practical nurses are using their findings in their practices to improve the health outcome of the patient, family, society, and the community. So there are many studies have found out different barriers, including the lack of research knowledge among nurses, inadequate facilities, inadequate time, the workload that are shown in the slide. So I'm going to find out these factors in my study. Material and method, this study was conducted among registered nurses working in different departments at Liaquat University Hospital, Jamshoro and Hyderabad. Total 141 were my samples, and I actually got 121 response. And from that, quickly going towards my results. As my results are there, majority of our nurses were there female, and only from all 121 nurses, 2 candidates had completed their MSN, and only 2 had MPH degree. Basically, I focused on 3 barriers: the nurse-related barriers, number 2, organization-related barriers, number 3, the research-related barriers. So which barrier is most commonly hindering the nurses to use their evidences in their practices? So I found out the 2 main barriers in nurse research-related variables. As based on finding, nurses don't feel to have enough authority to change the patient care, or they don't feel empowered to take the decision regarding patient care, so that could be a factor or the causes. Number 2, they said, I have no ability to conduct the research. So we need to rethink on that. Why nurses are saying they don't have the ability, we need to focus on that. Number 2, organization-related factors. The 2 main factors were found over there. As shown in this slide, there's no facility of computer and internet. Number 2, the nurses said they basically research seminars at their institutions are not being organized as they should be. And number 3 also was there. They said we have insufficient time on the job, so we cannot focus on the new findings to implement in their practices. Number 3, the research-related barriers means the research being conducted. We need to find out if researches are conducted, then why these findings are not used in the patient care. So the nurses responded that they said that the research reports or articles are not readily available, so where they can find these articles to get the new ideas. So from these articles, they can get the new evidences, they can improve their patient care. So some facilitating factors were suggested also by those nurses. They said that the research training for nurses as 38% to maintain the nurse-patient relationship, to decrease the burden on the nurses so they can focus on other evidences, and the motivation of organization is also very important for nurses to take part. The last one on the conclusion. All these factors are being shown very important, but study proved that related to the nurses, we need to focus on the factors that the trainings and workshops should be arranged for the nurses so they can take part on that, they can get their knowledge, they should know how to implement those findings. As we know, only conduction of research is not the, time is over. Okay, so we need to facilitate the nurses, we need to motivate the nurses to take part in research workshops, research seminars, and to have the part with the interprofessional collaboration to decrease the workload of the nurses, so nurses can focus to improve their health care of their patient, society, not only in the patient care setting. We need to use the research evidences in teaching and the management strategies to advance our nursing profession, to improve the image of the nurses. Thank you very much.
Thank you very much, Ms. Tasleem Bibi, and for presenting so nicely. The next presenter, Ms. Iram, is requested to come forward for her paper, if she is available. Ms. Iram, and after Ms. Iram, Dr. Sara Shafi should also be ready. The topic of Ms. Iram is knowledge, attitude, and practices of nurses in infection prevention and control within a tertiary hospital in Multan. Very important topic nowadays, IPC, infection prevention and control. So hopefully we'll have good information from this paper. Ms. Iram.
Thank you so much. Good afternoon, everyone. I'm Hiram Qureshi, MSN student. I'm here to present my research abstract. The topic is knowledge, attitude, and the practices of the nurses in infection prevention and control within a tertiary hospital in Multan. As we all know that infection control is the most important in the clinical setting. The infection rates are increasing day by day and causing mortality and morbidity. So nurses are the healthcare professional whose duty is to protect the patient from acquiring infections while hospitalized or while in a healthcare setup. The purpose of study was to check the knowledge of the nurses and assess knowledge, attitude, and the practices of the nurses in the IPC and within a tertiary care hospital of Multan, and to make recommendation to the risk program and policies of the tertiary care hospital. I chose quantitative descriptive study method to conduct my studies. After ethical approval, I used questionnaire method to assess the level of knowledge and practices and attitude also. The clinical setting were including the environment of clinical setting, means the place where the nurses are usually applying their knowledge and practicing their whole workup. The inclusion criteria, all the clinical nurses were included in my research, and all the managers and the administrative nurses were excluded from my study, as well as the participants utilized for the pilot study were also excluded from the main study. This is showing the whole population. The whole population was around 281, and I chose through certified random sampling 196, and these are for the categories of the nursing specialties. These were the variables which were assessed in the nursing. These were the attitude variables, including the attitude toward the importance of the IPC guidelines. And these were the practice variables which were mainly focused, like practices of hand washing used during the patient care, the utilization of the personal protective equipments as per situational demand, adherence to the standard precautions and the routine use of the sterile technique, safe needle disposal, and the waste management. The data was analyzed on the SPSS version 22, and these are my research findings. Mainly, as we see that mostly the nursing and the other health professionals have great knowledge regarding the infection prevention and control. As you see, the 83% nurses were having knowledge about infection prevention and control, while the 81% were having good positive attitude toward the IPC guidelines, but there is a lacking in the practices, like 48.8% nurses were doing the proper infection control practices in the clinical settings. So here are some recommendations that, as we all know, that in public setups, there is overburdening of the task, and the patient to nurse ratio is quite low. So we have to increase the patient to staff ratio in the public setups to reduce overburdening of the task, so that the nurses can focus over the IPC guidelines. Training of the charge nurses, while with the close observation of the IPC practices, compliance in the clinical settings. As we all know that multiple trainings over IPCs used to be done, but there is no observation, there is no check and balance. Are they applying this knowledge in their clinical setting or not? So the observation to the compliance is quite necessary. And the most important is the appraisal to the motivate staff, and designation of trained infection control nurses and infection preventionists in the public setups. These are few references. Thank you so much.
Thank you very much. Iram was presenting her paper on infection prevention and control. So before the next speaker comes and presents her paper, if any question regarding these 4 presenters, so if any question from audience or our learned guests.
Thank you. I am Alia Nasir. First of all, I would like to congratulate all the presenters who has presented their studies very confidently, and very practical questions or problems were selected for your research. So congratulate you all. My first comment to the dentist who has done, and this research should be integrated as a multidisciplinary research with the nursing, because first role of nurses defined by ICN is promote health and prevent illness. So these 2 departments should work collaboratively to conduct further researches at the master's level. Then the second presenter who has presented about the why research findings are not utilized. Yesterday we have learned from our very experienced nursing leaders that how they have incorporated the findings at the policy level. जैसे डॉक्टर रोजीना ने बताया था कि उन्होंने जो है वो प्ले के ऊपर किया था और फाइंड आउट किया था कि प्ले के दौरान चाइल्ड अब्यूज़ और डोमेस्टिक वायलेंस का किस तरह से आया था और उसकी रियरिंग में कैसे चल रहा है, वो फिर जब बच्चे फादर बनते हैं तो वो कैसे परपिट्रेट डोमेस्टिक वायलेंस होता है। तो उन्होंने प्ले की एजुकेशन और हेल्थ को मिलकर, मिनिस्ट्री ऑफ हेल्थ और एजुकेशन ने मिलकर करिकुलम इंट्रोड्यूस कराया है। तो ये बहुत मुझे खुशी हुई कि आपने भी इस तरह से रिसर्च की है और हमारी मैडम प्रेसिडेंट भी यहाँ पर हैं जो भी बहुत इनटू फर्दर है। तो मैडम मेरी रिक्वेस्ट होगी आपसे कि ये रिसर्चेस जो हमारे बच्चे कर रहे हैं, जो यंग साइंटिस्ट हैं, उनको इस प्लेटफॉर्म पर बुलाकर और करिकुलम में इंटीग्रेट कराया जाए।
That's great. Thank you, madam.
और
Thank you for your
तीसरी
valuable
एक
comments.
आखिरी मेरी कमेंट, मुझे सबसे ज़्यादा जो खुशी हो रही है कि मेरी सिंध की लड़कियाँ इतनी कॉन्फिडेंटली, इतनी बोल्डली, इतने अच्छे प्रेजेंटेशंस कर रही हैं और वेरी प्रैक्टिकल चीज़ों को किया है। जिस तरह मेरी वाइस चांसलर से जो कल मुलाकात हुई है इस प्लेटफॉर्म के थ्रू सब सीनियर मैनेजमेंट से, तो सब इंटरेस्टेड हैं कि नर्सिंग के स्टैंडर्ड ऑपरेटिंग प्रोसीजर, नर्सिंग की हॉस्पिटल की क्वालिटी को बढ़ाया जाए। तो ये जो इन्फेक्शन कंट्रोल का जो रिसर्च है उसको ज़रूर इंटीग्रेट करवाएं। थैंक यू।
Thank you very much, Madam Alia Nasir, for your valuable comments. And please have your seat. Now we are proceeding for another presentation. जिस तरह से IPC को एक डिफरेंट था, तो अब जो आने वाली प्रेजेंटर हैं उन्होंने भी जो टॉपिक लिया है वो डिफरेंट है थोड़ा, and it relates with the global environmental health issue. So Dr. Zahida Parveen Jamali. Dr. Parveen Jamali is requested to come forward, and her topic is coal-fired power plants and community air quality, 8th District Tharparkar, a global environmental health issue. Give her a big hand, Dr. Zahida Parveen Jamali. She has come all the way from Tharparkar to present. Thank you.
My respectable panelists and future and present Agriyas, Assalamu alaikum, Haq Mojud. I am Tharparkarian, that's why I conducted my case control research study in Tharparkar. You all know very well, Tharparkar is green desert among all the world, alone green desert, which is nowadays, recently, on a higher threat of agro coal fire mining. You know, there are 4 types of coal, and lignite is most youngest and most dangerous coal for the environment, for the all livelihood, for the greenery, for the livestock. That's why I choose in my study about the environmental threats. It is the coal power plant, and my keywords are coal fire, environmental disaster, greenhouse gases, volatile elements. Actually, 250 words for any research paper is as like you are inserting ocean in a small bottle. Introduction. In this integrated world, not our concrete structured house, but environment is a real house. Coal fossil fire is an environmental disaster which release large amount of greenhouse gases into the air and contribute to the yearly growth of carbon dioxide in the atmosphere. Greenhouse gases can cause respiratory illness, heart illness, asthma, chronic bronchitis, strokes, and pulmonary heart disease. Other volatile elements like arsenic, fluorine, and mercury will pollute local water sources and crops, mercury has toxic effects on the nervous, digestive, immune system, lungs, kidney, skin, and eyes. Very interesting fact I want to share with all of you. Effects of the coal fire will start after a century, and these all effects will be irreversible. We can't reverse to those effects. Purpose of study: to screen out an association of chronic cough with exposure of coal fire pollution in coal fire workers of Islam Court Tharparkar, because Angro coal plant is situated in Islam Court. Material and methods. I have already described. It's a case control study design. Sample size were 2 groups. These all 2 groups were non-smokers. 50 were exposed, 50 were non-exposed. These were healthy male and female. क्योंकि आप जानते हो कि वहाँ पे ब्यूटी है कि फीमेल डंप ड्राइवर्स हैं, वो बहुत बड़े बड़े वहाँ पे जो है ना मशीनरी को ऑपरेट करती हैं, अंदर कोल तक जाती हैं. Sampling technique that was so simple, exposed and non-exposed group. Way to conduct survey, only clinical examination and questionnaire survey. I want to share names of those villages that are a little bit difficult to remember for me. That's why I have written Varvai, Mehari, Adejuttad, Thario Halepoto, and Snehri. These were the villages where that study I conducted personally during the April to June 2022, because that was not rainy season, that was not exposed to the cold and cough season. That's why I choose that season. Results. Exposed, I have already told you, I took 50 exposed and 50 non-exposed. That's why odd ratio was ideal for me to analyze the results. And that is the diagram of the odd ratio. When I conducted the study, I found 32 exposed individuals were suffering from chronic cough and shortness of breath. Only 18 were intact. And when I studies to non-exposed pupils and non-exposed sample, only 12 were suffering from chronic cough and shortness of breath. And 38 were intact. They were not suffering from any disease. Ideas of present and future, you all knows very well odd ratio formula, that is A multiply D divided by B multiply C. So result was come 5.6. And when result will more than 1 plus, it means there is a strong association. Conclusion. Association found between disease and exposure of coal mine pollution. So preservation of natural ecosystem is responsibility of everyone to identify the adverse effects of coal. Such a detailed screening of workers, fish pond, which is available there, and coal clay is required, and result with suggestions should submit to the accountable agencies. Thank you so much.
Thank you very much. Thank you very much, Dr. Zahida Jamali, for presenting your unique work. Please be seated.
Thank you.
So here we complete the presentations. All the papers are completed here. And now Dean Faculty of Community Medicine, Professor Dr. Munawar Alam Ansari Saab wishes to comment on these papers as well as overall session of this plenary.
Thank you, Dr. Gulzar. You see, it was really a very remarkable scientific session I've seen ever. Different, you have touched, thank you very much. The presenters have touched very key points and the key issues, the community issues. Some has talked about the depression, the very hot and burning clinical problem of our society. Some was talking about the air pollution, the worldwide topic to be discussed. So what such sort of presentations and such sort of research, they reflects the interest and intentions of the researchers. So it's really very remarkable, and I congratulate all of you.
Thank you very much, sir, Dean Community Medicine and Basic Medical Sciences. Now I will hand over the mic to chair and co-chair of this plenary session. So they will comment on it. Ms. Janila is our co-chair.
Hello, I think the session is very good, and it shows that the nurses have a power to present, they have a power to do the research, and they have a power to publication. So I think it's very good platform for us. It gives us encouragement to do further researches, further find out further problems, and implement in our areas also. Well done, research, nurses, doctors, all health professionals. Thank you.
Thank you very much, Madam Nila Khwaja, co-chair of this session. And now, last but not least, the chairman of this plenary session, Professor Dr. Muhammad Ilyas Siddiqui. He's head of Department of Community Medicine, LUMHS.
Thank you, Dr. Gulzar. First, I will say congratulations to the nursing faculty, PNS faculty of LUMHS for arranging this wonderful first ever nursing research conference in the LUMHS. So arranging the conference is not an easy task. It really requires a huge mind and workforce behind it. So huge applause for them. Secondly, it was a wonderful scientific session. Everyone presented their scientific work, and the results of these studies will definitely benefit our society. So I will encourage all researchers to get their research published in the quality research journals, in the valuable research journals. That's the need of the time. Thank you.
Thank you very much, Professor Dr. Muhammad Ilyas Siddiqui, the chair of this plenary session. And we'll take the advantage of presence of the President of Pakistan Nursing Council, Madam is here. So, ma'am, specifically on this scientific session of papers and this research culture and inclination of these students and young researchers, what will you say? Is this encouraging sign, and how much expectations you have taken from this whole activity as a president of Pakistan Nursing Council?
I'm very glad, and I feel proud to see the presentation and the leader of the future of the LUMHS University. I appreciate your efforts to choose these diamonds from the more than 600 students or more than 1,000 students. This is a very proud movement for me as a president of Pakistan Nursing Council. I feel proud. Thank you.
Thank you very much, Madam, for your valuable comments. And now, ladies and gentlemen, we are in conclusion, and soon we'll start the awards and certificates distribution ceremony, but we are waiting for the participants of Hall 2. The second plenary session is also almost over, and Madam Parveen Akhtar has entered in hall. A huge round of applause for this lady who made this all possible. मैडम, मैं समझता हूँ सबसे बड़ी कामयाबी यही है कि ये जो बच्चे हैं ये आपसे इतना प्यार करते हैं, इन्होंने इतना कुछ सीखा है, तो यकीनन ये सबके लिए बहुत प्राउड की बात है। थैंक यू। So here we concluded the scientific session, and now proceeding further, I think after these 2 days activities, our worthy Dean, Faculty of Community Medicine and Basic Medical Sciences, Professor Dr. Munawar Alam Ansari Saab, he was all the way with us yesterday as well as today. So we all would like to listen from him as a Dean of Faculty. So give him a big hand, Professor Dr. Munawar Alam Ansari.
Thank you, Dr. Gulzar. The President, Pakistan Nursing Council, Director, Nursing School, distinguished guests from all over the Pakistan, Sir Majid Chaudhry Sahab, no need of any introduction, teachers of the teachers, teachers of the teachers. It's really, and my dear students, it's really the matter of great pleasure and honor for the Liaquat University of Medical and Health Sciences that the School of Nursing has arranged such sort of academic and research event and the conference. I must congratulate the entire team of Madam Parveen, who worked so hard day and night that such sort of event is possible. Such sort of conferences, such sort of symposia, workshops, they create linkages. They create the platform for exchange of the views and thoughts that are very much important. जब तक आप आपस में बैठ के सर से जोड़ के अपने ख्यालात को एक्सचेंज नहीं करेंगे, हमारे इंस्टीट्यूट्स जो हैं वो फ्लोरिश नहीं करेंगे. So for the betterment of the institute, such sort of sittings, they are very important. इसमें scientific matter भी आते हैं, इसमें academic matter भी आते हैं, इसमें extra curricular matters भी आते हैं. एक मौका मिलता है आप सब लोगों को बाहर निकलने का, तफरीह करने का, मिलने का, मेल जोल का. You see, within the increasing population of the patients, it's the need of the day, because still the number of the nurses they are very short. There is huge shortfall of the nursing staff. So we does not only create the qualified nurses, but we want to create the qualified, skilled nurses, which are very much skilled. We don't need the piece of paper कि आपने जो है वो डिग्री ले ली और उसको हवा में लहराया, टोपी को उछाला, फोटो निकल गया, आप फेसबुक पे लगा दिया, 100 कमेंट्स आ गए, अल्लाह अल्लाह खैर सल्ला. नो वे, नो वे. हमें, बिकॉज यू सी द नर्सिंग इज, जो मैं अब बोलने जा रहा हूँ उसको आप जस्ट गौर से सुनना. Nursing is the most trusted professional of the society. आपके पेशेंट्स जितना नर्सेस पे ट्रस्ट करते हैं उतना डॉक्टर्स पे नहीं करते. डॉक्टर आते हैं, राउंड करके चले जाते हैं. जब नर्सेस आते हैं अंदर तो पेशेंट्स के चेहरे खिल उठते हैं. Because you are in close contact. You are in close contact. When the community trusts you, when the society trusts you, so it's my humble request that don't break the confidence of the society. Usko बढ़ाएं, usko kam nahi करें. So again, I'm highly thankful to all my distinguished guests and the participants who came from very far away, from Lahore, from Islamabad, from Multan, and from the very far cities of this Sindh province. So this is very encouraging for us because this was the first international conference which is being arranged by the nursing school. Thank you very much. Thank you very much. अच्छा, कल वो आज एक बड़ा अच्छा वो एक मैडम थी, मैडम बैठी हुई हैं, उन्होंने हमें 2 शेयर सुनाए थे. तो जो कल प्रेजेंट होंगे वो शायद ही देंगे. उन्होंने 2 शेयर सुनाए थे. हालांकि उन्हें सिर्फ 2 शेयर नहीं सुनाए थे, उन्होंने पूरे हॉल को गरमा दिया था. ठीक है ना, हॉल को गरमा दिया. तो I was sitting beside my honorable vice chancellor, तो उन्होंने मेरा हाथ पकड़ा और उन्होंने कहा कि तुम नहीं उठना, तुम नहीं उठना. तो मैं जाहिर है मुरवतन बैठ गया. मैंने कहा सर मैं नहीं उठ रहा, डोंट यू वरी, क्योंकि उनको पता है कि अगर ये उठा तो फिर दीवान खुल जाएगा. तो आज मैं, क्योंकि वो सर भी नहीं है, वाइस चांसलर अभी शायद आने वाले हैं, सर भी नहीं है और माइक मेरे सामने है, तो I just say I just say 2 lines for all my guests, for all my guests. उन वक्त ठरी था नैण पवन, उन वक्त ठरी था नैण पवन, थो दिल के सुकून के लो न मिले. जह वक्त असांजी महफिल में के प्यारा माण्हू ईंदा.
Thank you very much, sir. आपने तो बड़ा शायराना माहौल कर दिया, sir. And this is good thing कि literature and science, they all should be blended because we are human beings and we need all these things, science, arts, and these fine arts. So, big clapping for Professor Munawar Alam Ansari Saab, the Dean Faculty of Community Medicine, LUMHS. And now, ladies and gentlemen, it's time to present the certificates and some shields to the presenters as well as our volunteers and organizing committee. So soon we are going to start it. I would like to request Madam President, Pakistan Nursing Council, Dr. Shazia Sobia Somro. Madam, please come on stage to decorate our presenters with certificates, awarding them certificates. Dean Faculty of Community Medicine is also requested to come and join at the stage, Professor Munawar Alam Ansari Sahab, and none other than Madam Parveen Akhtar, Chief Organizer of this conference and Director, People's Nursing School, LUMHS. Ms. Fatima will come and announce the names of presenters.
Thank you so much, Dr. Gulzar. Now I want to request Ms. Iram Bibi to please come and receive her certificate for the oral presentation. Iram Bibi, please come on stage. With your huge round of applause, Ms. Iram. Iram, huh? After Iram, now I would request Ms. Tasleem Bibi to please come on stage for receive her certificate. Mr. Manoj Kumar, please come up on stage for receive his certificate. Ms. Zahida Parveen, please come on stage and receive your certificate. Dr. Sabah Sumro, please come on stage and receive your certificate. Now, volunteers, get alert. Ms. Zahida Parveen, Dr. Zahida Parveen, please come and receive your certificate. Please give all of them a huge round of applause. Mr. Arslan Rajpur. Izhar Hussain, please come up and receive your certificate. Mr. Ishtiaq Ali. Mr. Ishtiaq, please come forward and receive your certificate. Savera Khalid. Nasir. Mr. Nasir, please come on stage, receive your certificate. Now, Ms. Hina Kamal is requested to please come up and receive her certificate. Khan Mohammad, please come and receive your certificate. These all were second year BSN students. Now the third year students. Mr. Usman, please come up and receive your certificate. Now Ms. Kalinas, please come up and receive her certificate. Sir Mushtaq and Sir Amala are requested to please come upstairs, accompanied with Dr. Shabir Jatyal. Please come. Also, Ms. Alia Nasir is requested please come stage to encourage our volunteers. They have worked so much. Please kindly huge round of applause for all of these distinguished dignitaries. Professor Dr. Ilyas Siddiqui is also requested to join for certification. Ikra Cha, then Mulk Lal Khan, please come on stage. Miss Ikra and Miss Mulk Lal Khan, please come up for stage for certification. Shagufta, Miss Shagufta, please kindly come up and receive your certificate. Vikesh Kumar is requested to please come up and receive his certificate. Miss Nahid Anwar, please come up and receive your certificate. Now, Mr. Gulab Khan, who has really worked so hard with us throughout the conference, please come up and receive his certificate. Give him a huge round of applause. He has really worked so hard. Akash Kumar, please come up and receive your certificate. Abu Bakar, please come and request your certificate. These all were nursing BS generic students. Please kindly give huge round of applause to all of them. Now, अब उनकी बारी है जो कि नर्सिंग से ना होते हुए भी हमारे साथ रहे हैं, हमारे MBBS के वॉलंटियर्स जो कि खुद से आए और उन्होंने कहा कि हम भी आपकी कॉन्फ्रेंस में पार्टिसिपेट करेंगे. गिव देम बिग हैंड्स. Sayyid Muhammad Raza Naqvi, MBBS third year student. Then Muhammad Zaid, please come up and receive your certificate. Sajid Ali, please come up and receive your certificate. Then Faisal Ali Ilahi, please come up and receive your certificate. Faisal Ali from MBBS students. One of our BS final year student has unfortunately missed, so I want to call her. With your huge round of applause, Ms. Tahira, please come on stage for receive your certificate. Please give her a huge round of applause. Now, I would like to call our Masters of Nursing students, Mr. Saad Raza, to please come up and receive his certificate. After Saad Raza, Muhammad Khan is requested to please come up and receive his certificate. Qurban Ali, please come and receive your certificate. Mr. Pehlaj, we want to welcome Professor Dr. Abdul Majid he is the best motivational speaker for joining us on stage. Please give him big hands. Qurban Ali is kindly requested to receive certificate. Then Pehlaj is requested to receive his certificate. Shankar Lal is requested to kindly come up and receive his certificate. Miss Iram, please kindly come up to receive another certificate. Tasleem, MSN student, is requested to please kindly come and receive her certificate. Miss Hafsa, MSN student, please come up and receive your certificate. Mr. Abdul Karim, MSN student, is requested to please kindly come and receive his certificate. Sabiha is requested to please come up and receive her certificate. Sabiha, MSN student. Farzana is requested to come up and receive her certificate. Miss Farzana, MSN student. Miss Sanam is requested to please kindly come up and receive her certificate. Please give our volunteers a huge round of applause. They have worked very hard throughout with us. Mr. Ishtihaq, please come up to receive your certificate. Where were you? I guess he was working as a volunteer while we were distributing the certificates. Please give him big hands, Mr. Ishtihaq. He is also the video editor of our conference video documentary, so please give him a huge round of applause.
Thank you. Our dignitaries are requested to please be seated. We have still a few more shields and awards for the Hall 2 presenters, and Hall 2 presenters are also coming with their panelists. I will request the panelists to provide the list of your presenters as we can call them for certificates. अच्छा जी, हाल 2 के जो प्रेजेंटर्स हैं वो भी हमारे पास पहुंच चुके हैं। आज हमने 2 प्लेनरी सेशंस का इनेकाद किया था, एक हाल 1 में, लतीफ़ हाल में, जो कि अभी आप सबके सामने उन्होंने प्रेजेंट भी किया, एंड दे आर अवॉर्डेड विद द सर्टिफिकेट्स, एंड सेम विल बी गिवन टू द हाल 2 प्रेजेंटर्स, एंड विद द परमिशन ऑफ चेयर अगेन आई विल रिक्वेस्ट मैडम प्रेसिडेंट ऑफ Pakistan Nursing Council and Dean Faculty of Community Medicine to come forward along with Professor Abdul Majid Chaudhry Sahab and Professor Dr. Muhammad Ilyas Siddiqui Sahab to give the certificates of appreciation to the presenters. So first of all, the presenter So first of all, अच्छा मैं यहाँ इस प्रेजेंटर को कॉल करने से पहले आपको मुझे वो एक डिफरेंस याद आ गया कि व्हाट्स डिफरेंस बिटवीन लीडर एंड बॉस. बॉस हमेशा हुक्म देता है और लीडर जो है उस एक्टिविटी को लीड करता है, उसका हिस्सा बनता है. आर यू एग्रीड विथ मी? और ये प्रूव किया है हमारी डायरेक्टर मैडम परवीन अख्तर ने. शी वॉज overall chief organizer as well as presented her paper. So these are basically the role models for you younger students कि किस तरह से आपने आगे जाना है. हालांकि इस पूरी कॉन्फ्रेंस का सारा इतनी ज़्यादा बहुत बड़ी एक्टिविटी होती है, कितनी बड़ी जिम्मेदारी होगी उनके कंधों पे, लेकिन she never forget her own role as a researcher. तो उन्होंने अपना पेपर प्रेजेंट किया है